So I want to welcome you all to today's program. My name is Kyle Jackham. I am a program coordinator at Crossroads for Hope. On behalf of Crossroads for Hope and Robert Wood Johnson University Hospital, Somerset, we are happy to welcome you to our webinar, Make Time for Mammography, sponsored by the Far Hills Race Meeting Association and Robert Wood Johnson University Hospital, Somerset's Community Health Partnership. During today's session, we will learn causes of increased mortality, strategies to reduce the risk of breast cancer, signs and symptoms, the importance of getting an annual mammogram, and treatment options. Our presenter today is Atiya Muhammad Calloway, a procedure nurse at Robert Wood Johnson University Hospital, Somerset Steeplechase Breast Care Center. Thank you for joining us today. And Atiya, I will hand it off to you.
Thank you, Kyle. Good afternoon, everyone. Again, my name is can you hear me, Kyle? I'm sorry, it's kind of feedback. Can you hear me okay?
Yes, we can.
Okay, just wanted to make sure. So again, good afternoon, everyone. My name is Atiya. I am a registered nurse here at Robert Wood Johnson University Hospital, Somerset at the Sanofi U.S. Breast Care Center. So I'm going to talk to you briefly this afternoon about breast health for African American women. So I'm going to get started, and if there's any feedback or delay, please just let me know. Hopefully you can hear me okay. So I'm going to start with the presentation now. Okay, so I'm going to start briefly. First, I'm going to start just talk about the Susan G. Komen nonprofit organization. This nonprofit was actually started by the Susan G. Komen nonprofit organization was actually started by Susan G. Komen's sister, who Susan G. Komen was a actual breast cancer patient who we did lose. The nonprofit organization, it addresses breast cancer in a multi-level approach. It ensures that disease being impactful in the largest way possible. So it offers everything from research, community health, global outreach, public policy. A little bit more here about the Susan G. Komen Foundation. It has invested over $2.9 billion contributing to cancer research and community health outreach advocacy programs. One-stop shop again for facts, statistic, risk factor screening and detection, diagnosis, treatment, and much, much more. Okay, so we're going to start with a pre-presentation poll. I'm going to allow Kyle to bring that up. So we have some true or false questions that you can answer via the poll.
I'm going to launch the poll right now.
Okay. I'll give you guys a couple of minutes to fill it out. And we'll talk a little bit about the answers during the presentation.
We'll give it another 30 seconds and then we'll end it. I still see some people taking it.
Okay, just let me know when you're ready to go.
Of course. All right, I'm going to end the poll now.
Okay, so I'm going to move on to the next slide. Okay, so we're going to talk about some of those questions that we had in the pre-poll. So we're going to go through some of those questions. So breast cancer, myths or facts. So the first question, breast cancer is the most common type of cancer in pregnant and postpartum women. So is this a myth or is this fact? So this is actually a fact. So due to the changes, hormonal changes during pregnancy, breast size, shape, lumpiness, it is important that screening is a part of pre and postnatal care. So that's actually a fact. So the next question, there is nothing that you can do to lower your risk of developing breast cancer because it has nothing to do with hereditary factors. So what do you think about that? Okay, that's actually a myth. So there are things that we can do to lower our risk factors for developing breast cancer. And we'll talk a little bit about that more in the slides. So young women under the age of 30 specifically can never develop breast cancer. Is that a myth or is that a fact? That's actually a myth. Men have a chance of developing breast cancer, myth or fact? If you think about that, just kind of keep that in your mind, see what you think. It's actually a fact. Men can develop breast cancer. All right, so let's do a little overview of breast cancer. What is breast cancer? So breast cancer actually develops or it occurs when cells in the breast divide and grow without their normal control. Breast cancer is a disease where malignant, or another word for malignant is cancer cells, form in the tissues of the breast. So there are two types of breast cancers. There's what we call invasive, and then there's also metastatic. So metastatic, this is also known, you can hear it commonly called stage 4 breast cancer or advanced breast cancer. So what happens is this tumor has spread beyond the breast tissue and it has moved to either the lymph nodes, axillary lymph nodes under your arm, or it has moved to other organs and parts of the body. So that can include most commonly the bones, lungs, liver, or the brain. All right, so invasive. What's invasive breast cancer? This is actually when the milk ducts of the breast, this actually happens in the milk ducts of the breast. And it can also travel to the nearby tissues of the parts of the body. And the way that it moves is via the bloodstream. Also, it can also move through the axillary lymph nodes under the arms. This can occur at any time of the process, tumors that are small or large in size. All right, and here's a picture. So if anyone is a visual learner like I am, you can see what's happening here. And if you can see my mouse, you'll see this is where the multiplication of cells is happening. And then this is basically when it's dividing and just beginning to become malignant and what we call out of control. All right. So here's a depiction of normal breast tissue. This is the way that the breast formation should look. So on the left side, you'll see a normal breast tissue. You'll see your nipple, you'll see the ducts of your breast there, and then you'll also see these green little chain looking things. This is what we call the lymph nodes. This is under your arms. So you can see how this can actually become a pathway for malignant or cancer cells to travel to other parts of the body. On the right side here, you just see a side profile view, or it looks like a slice of the breast. You'll see the ribs, you'll see the chest wall, then you'll also just see the breast tissue and then the surrounding fat tissue. And this is the formation of a normal looking breast. This is the way that it should look. All right, so a couple of quick facts about breast cancer. So there are an estimated breast cancer new cases in women. There are 266,120 new cases of invasive breast cancer, 40,920 breast cancer deaths in women. In men, we have 2,550 new cases of invasive breast cancer and 480 breast cancer deaths. So this goes back to that question that we had originally. We do see cases where men definitely can be diagnosed with breast cancer. 1 in 8 chance that a woman in the United States will develop breast cancer in her lifetime. Breast cancer is the most commonly diagnosed cancer in women. breast cancer is the second leading cause of cancer death in women. So here are a few statistics about breast cancer. So I wanted to, hope you can see my mouse. I'm sorry, the background is a little white, so I'll try to just read it. If you can't see my mouse, I do apologize. So the rates of breast cancer in the United States varies by race and ethnicity. White and Black women have the highest rate of new breast cancer cases overall, other than any other ethnicity. In 2010 through 2014, there were 125 new cases of breast cancer for every 100,000 African American women. From 2010 to 2014, breast cancer mortality of deaths in Black women were 42% higher than white women. So I wanted to point out over to the right on this graph that we see here, according to the statistics, Black women were, according to the statistic, breast cancer mortality or deaths in Black women were 42% higher than white women. So I just wanted to point that out here based off of the statistics that we have here. So a little bit more, Black and non-Hispanic Black women have a slightly lower rate of breast cancer compared to other ethnicities. For women younger than 40, non-Hispanic Black women have higher rates of breast cancer compared to white women. Between the ages of 65 and 84, non-Hispanic white women have higher rates of breast cancer compared to non-Hispanic Black women. The reason for this disparity is under review. However, it could be related to lifestyle factors, as well as the differences in tumors, structure of biology, etc. Okay, so when we talk about tumors, you hear the word tumor can be described either as benign or malignant. So we talked about malignant a little bit before. So malignant, these are cancerous tumors. They can be more aggressive than benign tumors, and they have the potential to spread to other nearby tissues in other parts of the body. Benign tumors, they're non-cancerous. Usually compared to lumps in the breast, does not invade nearby tissues or spread to other parts of the body. Okay, so we can see here in comparison, when we talk about the average size of tumors, we can compare them to dime size. So here, the pink one at the top, I'm sorry if you can't see my mouse. The pink one at the top, you can see they're compared to the US coin. So the first one, the average size lump found in yearly mammogram when past images can be compared. The green one, which is next to the dime, we have an average size lump found by first mammogram, and then the blue one at the bottom, average size lump found by accident. So what we can see here, I want to point out, is that the importance of mammograms is because most patients, when they come in, they have a mammogram done, and then the radiologist or the doctor that reads it says, well, there's an area that, you know, we are a little bit concerned about. We would like for you to come back for additional imaging. And then patients will say, well, I don't feel anything. So as you can see, I want to point out the first two lumps, the average size, you wouldn't feel this. So the bottom, this is, by that time, this is where you'll feel it. So you can see the difference between how big how the lump has grown in size when you would actually start to feel it versus when something can be found by a yearly mammogram. Okay, so let's talk about breast cancer stages, and then with the survival rates. So at stage 0, 100%, stage 1, 98% survival rate, stage 2, 88% survival rate, stage 3, 52% survival rate, and then stage 4, 16% survival rate. And we can see here at stage 4, you can actually see how that breast cancer has spread to a number of places in the body. So it's no longer just in the breast tissue and the surrounding area, such as the underarm. It's actually spread to different organs and places in the body. Okay, so let's talk a little bit about symptoms of breast cancer. So symptoms can include swelling, skin irritation or dimpling. It looks like actual dimpling in the breast, breast or nipple pain, nipple retraction, redness, scaliness, thickening of that breast tissue or the nipple, and then nipple discharge. So not the breast milk, more so breast actual discharge. All right, so here's some more pictures of symptoms of breast cancer, and you can see some actual physical changes here via these pictures. Discharge, you can see swelling, constant pain. So let's talk about, are you at risk? All right, so what are the risks? So let's talk about the risk factors. We did speak earlier. One of the questions was, are there any risk factors? Is there anything that I can do to actually help my risk for developing breast cancer? So we'll talk about that a little bit. So here are the risk factors: race and ethnicity, family history or personal history of breast cancer, age at first menstrual cycle or menopause, being overweight after menopause, birth control pill, and also IUD. That's an internal intrauteral device. Alcohol consumption, exercise and physical activity rates, fruits and vegetable consumption, and then also having dense breasts. Okay, so let's talk about breast density. What is breast density? A lot of patients, they're very confused at what breast density is. What can they do? Is there anything that they can do to change their breast density? So basically, breast density is you're considered to have more dense breasts when there's more breast tissue than fat tissue. So here you can see what a fatty breast would look like. And if we go back to, if you remember the picture before where it showed the breast lobules, the milk ducts, and then it showed the breast fat that was around it. Here we're just seeing the breakdown. We see just a fatty breast. We see a breast that has some density. So we have some fat there, some lobules, some milk ducts, and then you can see as it gradually increases, breast density gradually increases for these different breast types. You'll see that some breasts, they're going to have a little bit of fat with a little bit of breast lobules, and then you'll see more. It increased as we go to different types of breast density. All right, so reducing your risk for breast cancer. So what can you do? Yearly mammograms and clinical breast examinations. So you have your mammogram every year. And then you also want to make sure that you're having a clinical breast examination. So that's by your doctor, patients have them by their primary doctor, your OBGYN for your yearly exams. So having a mammogram, even if you or your family members have no history of breast cancer, can help reduce your risk. It's a very, very common statement that I hear when patients come in to get their yearly mammograms, and then they're, well, I don't have a family history of breast cancer. So we want to make sure that you're still having your yearly mammograms, even if you don't have a personal history or a familial history of breast cancer. Reducing alcohol consumption. Women who have 2 to 3 alcoholic drinks per day had a 20% higher risk of breast cancer. Increasing physical activity. So these are things that you can do to help lower your risk for developing breast cancer. So you see, as we're going through these, we're answering that question from before. What can we do to help reduce our risk of breast cancer? Exercise about 150 minutes, 2 to 5 hours per week. It lowers, exercise about 150 minutes which is 2.5 hours per week in low or high intensities can help reduce your risk for developing breast cancer. Reduce consumption of foods with high levels of saturated fats. Examples: soul foods, fried chicken, other fried foods, mac and cheese, hush puppies, things that are deep fried and just doused in high levels of saturated fats. Also increasing fruit and vegetable consumption. So we want to increase our intake of foods that are natural colors, orange, melons, carrots, sweet potatoes, squashes. These foods are high in carotenoids. Women with higher blood levels of carotenoids have a reduced risk of breast cancer. It's very important. So weighing the pros and cons of BC or birth control pill usage. Studies have shown that women who take the birth control pill have a 20 to 30% higher risk for breast cancer. So you want to speak to your doctor about your options. So the importance of mammography. This is an important screening tool for all women, regardless of race or ethnicity. So what is a mammography or a mammogram? It's an X-ray that creates breast imaging. It can detect breast cancer in early stages. So if we go back to the images where we noticed the dime-sized amount lumps and then the versus the lump that on the average size where a patient will begin to start to feel it. What helps us find those lumps in earlier stages when they're smaller, of course, would be a mammogram. The procedure takes about 20 to 30 minutes. It's highly recommended to get an annual mammogram after the age of 40. In 2015, the ACS reported that 69% of African American women aged 40 and over had a mammogram in the last 2 years. So, and then we'll also speak on disparities and then the lack of access to healthcare. All right, so the mammogram process. So if you haven't had a mammogram yet, here we will show this is the process of a mammogram. So, and again, I apologize if you cannot see my cursor. So you'll see that there are two planes here. The breast is placed in between these planes. So this is what we call a top to bottom. And you'll see that the breast is placed on a flat surface so that we can spread the breast tissue out. Because remember, if we're going and we're talking about density, we want to make sure that we're getting the breast as flat as possible so that we can see as much as we can, so that we make sure that we're finding those lumps in those potential problem areas. Okay, and this is where the X-ray beam will begin to create that picture for the radiologist or doctor to view the mammogram. So how do you prepare for your mammogram? A lot of patients, they're very, very nervous, especially before, if they've never had a mammogram before, they're very nervous. If they did have one before, they're nervous to go back. So we'll talk about a little bit how to prepare for it. So if you've ever had a mammogram before, mammograms are read in comparison. So if you've had a mammogram, you live in New Jersey, you used to live in Chicago, you've had a mammogram at another facility, it's very important for the radiologist or the doctor that's reading your mammogram here to have something to compare it to from before, if you've had one before. So you want to bring or make sure we know the places that you've had these mammogram prior images so that they can be read, the new one can be read in comparison. So you want to bring those past records to the new facility. You want to have a knowledge of if you've had a history, a familial history, or if you have a personal history of breast cancer. You want to make sure that the staff at the facility that you're having your breast mammogram done, that we know and we're aware of those risk factors for you. You want to make sure that you schedule your mammogram when your breasts are not tender or swollen to the best of your ability. Of course, as you can see, the breast will be compressed. So we want to make sure that we have you as comfortable as possible as we can. And then also it's important, you want to avoid getting tested the week before your menstrual, again, because we want to avoid, that swelling, that tenderness, to make you as comfortable as possible because the breast will be compressed. All right, so we're going to talk about treatments for breast cancer. So there are different types of surgeries. There's radiation therapy, there's chemotherapy, there's hormone therapy, and that will all depend on the type of breast cancer that is at diagnosis. So there's the two different types of surgeries. There's a lumpectomy and there's a mastectomy. And we can talk about the two different what those two different surgeries are in detail. All right. So I think this is the part for the post. Let me see if I can go back. I'll just mention, so basically for the two different types of surgeries, the lumpectomy, this is where we're not removing the whole breast. So most of the time, if there's a very, very small area, we've caught this breast cancer at a very, very early stage, where we're able to just go ahead and the surgeon is able to just go ahead and remove that lump. And also, even if the lump was a benign lump and it's not cancerous, however, it may still have the potential to grow or cause problems for the patient, the surgeon may revert to having a lumpectomy, just removing that problem area. Versus a mastectomy, this is where the surgeon will go ahead and just remove that breast. Okay, and now we're going to go ahead and launch the post poll.
I'm launching the poll right now.
Okay. So with all the information that we've talked about, let's see if we can answer those questions again.
I see people taking it right now. So we'll give it another 30 seconds to a minute.
Okay.
People are still taking it. Okay. So I just ended it.
Okay. So let's see. Let's try to get back to here. Okay. So I will just let me know if it's moving for you, the presentation. Can you see the presentation still okay, Kyle?
Yep, it's on the resources page.
Okay, perfect. All right, so I did want to mention some resources that we have available. So of course, we have the RWJ Steeplechase Cancer Center here at Robert Wood Johnson University Hospital Somerset campus. We also have our neighboring Zufall Health Center. And then we also have our New Jersey SEED program. This is the New Jersey Cancer Education and Early Detection. And then again, we have our Susan B. Komen program here. You can see that here. I'm sorry, I'm trying to move the mouse. All right, these are our resources. All right, and any questions? Thank you guys for listening. And I will try to take any questions that we have.
Of course. So there is a question in the chat box. Someone had asked, why are men less prone to breast cancer?
So I'm trying to pull it up. And can you just, if I'm not able to get it, can you just repeat the question again, Kyle? I'm sorry.
Of course, no worries. Someone had asked, why are men less prone to breast cancer?
Less prone to breast cancer. Okay.
Yeah.
So unfortunately or fortunately, men do have breast tissue as well. They do not have as much breast tissue as women. So of course, if there is breast tissue there, there's always that risk factor for developing breast cancer. Men do not have as much breast tissue as women.
Awesome. Another question is, can wearing underwire bras be a cause for cancer?
Wearing underwire bras, that's actually a good question. I have not um, been made aware of any research studies or any evidence-based practice that has been made available that has studied underwire bras and being an increased risk for breast cancer, but that is a good question. I have not been, I'm not aware of any evidence-based practice that has led to that.
Awesome. Thank you. Another question came in. Is estrogen cream safe?
Is estrogen cream safe? So estrogen cream is actually prescribed for a number of reasons. It's very important that you speak to your doctor or your provider about the reason why you're being prescribed the estrogen cream, and then you want to weigh out with your doctor that benefit versus those risks with developing any type of cancer or any type of adverse reactions or responses into the body. So it's definitely, that's something that you definitely want to speak to your provider specifically when it comes to breast cancer or any type of adverse responses in the body.
Awesome. Can you speak on MRI and or ultrasound?
Oh, definitely. So I'll speak with ultrasound first. Usually in along with a diagnostic mammogram or versus, I'll speak with diagnostic versus a screening mammogram. So screening mammograms, usually you have every year, you really don't have any problems, nothing, you're just going for your annual mammogram. If there is a problem, you feel a lump, you're having any pain, tenderness that's, causing you discomfort, you're having any discharge, nipple discharge, you're having any new problems, these are typically your diagnostic mammograms. So when it comes to breast density, there are some things that we don't typically see on a mammogram that can be picked up on ultrasound. So when you have a diagnostic mammogram, which a provider has to provide you with a prescription for a diagnostic mammogram, or if you have a personal history of breast cancer, you may have a diagnostic mammogram, and in conjunction with that mammogram, your provider may also send you for an ultrasound. Things that may not have been picked up on the mammogram can be picked up on the ultrasound, and one of those reasons may be because of that breast density. So as you can see, the mammogram, it flattens the breast out so we can get it to an even plane to make sure that we're not missing anything on that mammogram image. However, we can see some things and can pick up things on the ultrasound. So that's another screening tool or diagnostic tool that radiologists can use to find areas and find problems and things that need to be addressed. MRI as well. MRIs, they pick up a lot of things. They're very, very sensitive. So sometimes what happens is if you do have a lot of breast, you have a lot of density in your breast, that can also be a very good tool that your provider will prefer that you have as well, because it can pick up things that maybe weren't picked up on ultrasound or a mammogram as well. However, you have to weigh the benefits and the pros and cons with your provider as well, because MRIs are very, very sensitive as well. So there, MRI and also ultrasound, they're another great screening tool for breast imaging. However, it's just something that you have to speak with your provider to see which one they want to prefer. But also the screening mammogram is always, always, always the gold standard and where we want to start.
Perfect. Thank you. Another question is, are there any side effects to radiation treatment?
So their radiation treatment or the radiation, I just want to make sure I'm understanding the radiation treatment or the radiation of the mammogram, like the radiation exposure of the mammogram.
I'm not too sure. The individual that typed the question, are there any side effects to radiation treatment? Are you able to just specify?
Well, I'll speak to both then, just to make
Okay.
sure to stay on. So with radiation treatment, there are always going to be, pros and cons to any treatment. Again, that's something that you would have to speak into detail with the provider. They will let you know versus, the benefits and risks to any treatment versus when there is especially a cancer diagnosis. With radiation exposure with the mammogram, there's always going to be, with the mammogram, there is radiation exposure. However, the amount of radiation is very, very minimal. We are exposed to radiation in our everyday life. We call it background exposure, just living here in, the northern eastern area. So it's actually, we kind of compare it to our background exposure here, just living in the city and the northern eastern area. So there is exposure, radiation exposure with the mammogram, yes, because it is an X-ray.
Awesome, thank you. A question came in, is there a time frame when to take the COVID vaccine so it will not interfere with the results of the mammography, MRI, or ultrasound?
Great, that's a great question, and I'm definitely glad you asked it. It's something that we're, COVID is new, it's our new normal, right? So yes, the Society of Breast Imaging has recommended that if you did have the COVID back, you want to make sure that you get your mammogram first before you receive your first dose of if you're doing the 2-dose treatment of the COVID vaccine. And if not, you want to wait at least 4 to 6 weeks after you've received the second dose. Because what we were finding was a lot of patients on the side that they had their vaccine were coming with swollen lymph nodes, swollen arms. So we want to make sure that we're not causing, a false positive where it's causing you to come back for additional imaging. And then when you come back for the additional imaging, everything's all good. The arm is no longer swollen. The lymph nodes have gone back to size. And it's just a reaction of the vaccine, right? It's your body's response to something foreign being there. And then, once you have had that response, the lymph nodes have gone back down. And then when you come back, everything's okay. So it's causing you to come, as the patient, to come back for additional imaging because the radiologist wants to make sure, wait, is anything going on? Is this something that we should be concerned about? So yes, that was a great question. I'm glad you asked it because we are going now, we're even opening up with, booster doses and things like that. So the Society of Breast Imaging did recommend if you're getting your yearly mammogram, get it before you receive your first dose, or you're recommended to get it 4 to 6 weeks after the second dose. Hope that helped.
Awesome, thank you so much. And then the last question that I see so far is, where are your doctors located?
So we are located here at Robert Wood Johnson University Hospital, Somerset, in the Steeplechase Breast Cancer Center. We are 30 Rehill Avenue. That's where the Steeplechase Breast Cancer Center. Thank you, Caitlin, for putting it in the chat. And we are located on the 3rd floor of the Steeplechase Cancer Center.
Awesome. Are there any other questions that you would like to ask Atia?
No, I hope and I pray, the information that I provided was received well. I apologize if there was any glitches here. I was trying to move the mouse and things like that. So I hope the information was received well. And I thank you all so very much for logging on and giving us your time. And I hope that something I presented today helps save you or save someone that you love. This is what I do. This is what I love. I love to speak about prevention of breast cancer, screening, and then just making sure that I'm taking care of my community. So thank you all so much for logging on and giving me your attention.
Thank you so much, Atia.